Put your hand at the back of your head with your three fingers. You feel it. Hi guys, and welcome to my channel. In my last video, I talked about breast cancer, the risk factors, and how you can get diagnosed. But in today's video, I'll be discussing how you can physically examine yourself for breast cancer and the signs to look out for during the examination. So physically examining yourself for breast cancer is very important because 8 out of 10 people that were diagnosed of breast cancer discovered the abnormalities by themselves and decided to see the doctor for proper examination. So it's very, very advisable that you check yourself at least every month to know if you can see any difference, anything that is abnormal from normal on your breast. Breast examination can be done anytime, but it is best you do it 1 week after your period because at this time your hormone levels are low, and then there's nothing influencing the texture of your breast because during menstruation or ovulation your breast can feel heavy, tender, or dense. It can be painful if you should perform this examination at that time. So it's advisable to do it 1 week after your period. Breast cancer can show up on many parts of your breast. It could be on the surface of your breast, it could be on the areola or the nipple. Breast itself is a large globular piece, while the protruding part is the nipple, and then the pigmented area around the nipple is the areola. So you have to check these parts of your breast during the examination. You also have to check your armpit and then areas around your collarbone for any lumps. So to do this physical examination, I'm going to give you acronym that you can use to remember the areas that you need to check during the examination. And the acronym is A, B, and C. Now, A stands for your armpit, while B stands for your breast, of course, and then C is your collarbone. You have to check the areas above your collarbone. Sometimes lump can reflect on your armpits or the areas above your collarbone. Okay, it's very advisable that you check these areas, especially for people who have large breasts, because sometimes lump can be difficult to find in people with larger breasts. So as for what to look out for during the examination, this is why it's important for every woman to know her body. Pay attention to your body so that you can be able to recognize when something weird or abnormal is going on. So I'm going to divide the process into two. First will be the looking part, while the second will be the feeling part. So I'll be giving you 3 poses that you can use to perform this examination. So the first 2 will be for the looking part, while the last one you may be lying down or you can be standing up to perform this physical examination, and it's going to be for the feeling. For the first pose, all you need to do is stand up, put your hands on your hip, your shoulder back, and your chest out. So look with your eyes to see if you can discover any abnormalities on your breast. You check for lumps or swelling, check for redness on the breast, you check for dimpling of the skin. Dimpling of the skin looks like orange peel. Check if the nipples are pulling in or if there is pain somewhere. You also have to check for discharge. Check for any discharge other than breast milk, like blood, anything abnormal that you can see. You have to check those things and note them down. Now, sometimes with this pose, you may miss out some parts of your breast, especially underneath your breast for people with larger breasts, which brings me to the second pose. All you need to do is raise your 2 hands up. Look underneath your breast to see if you can find anything abnormal underneath your breast. So if you can complete these 2 poses, then you have succeeded in completing the first part of the examination, which is the looking part. Now let's enter into the feeling part. So this one, you just have to put your hand at the back of your head, then you use your 3 fingers. These 3 fingers are what you're going to use. For some people, they might decide to go in a zigzag manner, while some they can go in a circular manner. So put your hand at the back of your head, with your 3 fingers, you feel it, in a circular motion. Feel it round, check every part of your breast, check your armpits for any lump, check your collarbone, to see if there is any lump. Okay, so once you have done this, then you have completed your physical examination. All you need to do is to do it again next month. Okay, and try to do it 1 week after your period. That's the best time. So when doing this examination, make sure that, of course, you are not supposed to wear your bra. Make sure you're not wearing your bra, and you can do it preferably when you are about to take a shower, or maybe after shower, because already you are naked, so you can just do it that way. The third part, you can do it while lying down, or you can also do it while standing up. So after completing both the looking and the feeling part, if you notice anything that is abnormal, anything that doesn't look normal, then you have to go to the hospital to see a doctor. The doctor can check you and see if everything is okay or not. So this is where I'll be ending this video. Make sure to subscribe to my channel. Share this video, please. Share this video to every girl or any woman around you, so that they will be enlightened about this case of cancer. Okay, early detection of cancer saves life. Put on your notification bell so that whenever I post a new video, you will be notified. Okay, like my video and comment. See you in my next video. Bye.
Say what you wanna say to me now.